A pleasant day, grade 8 learners! Mabuhay! How are you feeling today? Are you excited to learn new lesson? Great! Again, I'm your mom, Hannah, and I am here to help you discover and explore the amazing world of health education. But before that, see to it that you are ready together with your pen and paper. In this lesson, let our objectives guide us. Number 1, discuss the importance of breastfeeding for both the mother and the child. Identify the importance of responsible parenthood and the different methods of family planning. Analyze the effects of family size on the health of the family. Number 2, compose a 1-minute spoken poetry about the characteristics and importance of modern family planning methods. And number 3, value the importance of breastfeeding for both mother and the child and the importance of responsible parenthood. Before we proceed to our main lesson, let us have first a short recap of our previous topic. You're going to analyze each picture that's being shown. Then, identify what is being described by each picture.
Number 1. What is your answer? Correct. The answer is Harana. Number 2. If your answer is dating, you are correct. For number 3, the correct answer is marriage. You got it right. For number 4, if your answer is pregnancy, you are absolutely correct. For the last number, yes, good job. Prenatal is the correct answer.
This program is rated SPG. It contains scenes with themes, language, violence, sex, horror, or drugs, which may not be suitable for children. Strong parental guidance is advised.
Let's proceed to another activity, a Pictionary. A Pictionary is a drawn game where one person draws and other players try to guess what is being drawn. Okay, you have 10 seconds in each item to guess what is being drawn or portrayed on the screen. Let's begin!
Number 1. What is your answer? Very good. Mother. How about number 2? What is your answer? Correct! Baby. And for number 3, what is your answer? Good job! The answer is breastfeeding.
You did very well on this one. Keep it up! Let us watch the video carefully and attentively.
Bakit mahalaga ang newborn screening? Karamihan sa mga sanggol na may congenital metabolic disorder ay mukhang normal. kapag pinanganak. Sa pamamagitan ng newborn screening, ang mga kondisyong ito ay maaaring malaman na bago pa lumabas ang mga sintomas. Dahil dito, mabibigyan ka agad ng karampatang lunas upang maiwasan ang mental retardation o maagang pagkamatay. Kailan ginagawa ang newborn screening? Ang newborn screening ay nararapat isagawa makalipas ng 24 hours after birth. Okay? Paano ginagawa ang newborn screening? Kumukuha ng ilang patak ng dugo mula sa sakong ng isang sanggol at ito ay nilalagay sa espesyal na papel o tinatawag nating filter card at pinapadala sa newborn screening center.
What can you say about the video? Are you familiar with that scenario? Yes! The video is all about the newborn screening. Now that you know the importance of newborn screening for your babies, our next focus would be the quality and kind of food we give to them. What do you think will be the best? Yes, very good. Breast milk. Breast milk is the best food since it contains essential nutrients suitable for infants' needs. It is also nature's first immunization, enabling the infant to fight potentially serious infections. Grade 8, you are already on your way to a deeper exploration of our lesson. Let's watch and observe the online consultation of a pregnant woman to her OB-GYN. Can you help me decide whether to breastfeed or not? In 2011, the World Health Organization and UNICEF recommended that all mothers worldwide should initiate breastfeeding within the first hour of birth. I want to make sure I give my baby the best. And I can afford formula. So should I use formula? It's great that you want to give your baby the best. But breast milk is definitely the way to feed your baby. Your breast milk is uniquely made by your body for your baby. Because you carried and live with your child. Your body knows what your baby needs. Formula uses the same mixture for every baby, whereas your milk is especially made for your baby alone. Breast milk is a complete nutritional solution for the baby and the mother. It contains all the necessary nutrients a baby needs, and it is readily available from the mother. It is a simple natural solution for feeding. Additionally, it won't cost the mother anything, so it is also financially beneficial. Is there any other reasons why breastfeeding is the best? Yes, there are many benefits of breastfeeding for both the mother and child. But there are also many risks of not breastfeeding. Let's first look at the benefits of breastfeeding for the baby's nutrition. Each mother's milk is special and suited for her own baby. It changes from month to month, day to day, and feed to feed to meet the baby's need. Breast milk is the easiest for babies to digest. In addition, the mother passes on immune protective antibodies through her milk, which protect the child against infection. Babies who are not breastfed are more likely to get ill and could die from infections, such as gastrointestinal and chest infections. If formula-fed, they might be underweight and not grow well, especially if they live in a poor environment. Or they might be overweight and have heart problems later in life if they live in above average lifestyle. Did you know that mothers who breastfeed are less likely to develop anemia or to become pregnant soon after the baby's birth? They are also less likely to develop breast cancer or have a hip fracture in older age. Additionally, breastfeeding helps the mother lose fat gain during the pregnancy. This will lessen the childhood of obesity in later life. Thank you, Doc. I've decided to breastfeed. So, when should I start breastfeeding? We really recommend that you start breastfeeding within the first hour after birth, because the first milk you produce is the ideal nourishment for your newborn baby. It is called colostrum. It provides all the nutrients and fluid that your newborn baby needs, as well as many substances to protect your baby against infections. When the baby comes, can I give her other foods to make her stronger and grow well? And how long I should breastfeed for? That's a good question. We recommend that you exclusively breastfeed the baby for 6 months. That means no other fluids or foods are necessary, because as you now know, your breast milk is all your baby needs. After your baby is 6 months old, you can now introduce other foods. But remember, breast milk continues to be more advantageous. You may safely breastfeed until 2 years of age. These benefits of breastfeeding and the risk of not breastfeeding clearly show the importance of breastfeeding for both the mother and child. It's free, nourishing, convenient, and protects the baby against illness. It is very important for mother to know that it is her body that made her baby, and her breast milk is best. Your baby, your body, your milk is best. Do you know that breastfeeding your baby is not enough for you to be considered a good parent? Your responsibility being a parent still has a long way to go. Do you know more about this? So come on and join me as we discuss this next topic. How are your parents take care of you? How do they raise your family? Let's watch first and observe what kind of parenting the two families have. Are you ready, graded learners? That's great! What did you observe with the two families? Which one cares their children? Very good. Do you want to become a responsible parent also when the time comes to you? What are the things to be considered of showing care for the family? Let's find out by responding each statement with yes or no.
Number 1. Have a positive communication as an important part of parenting. Number 2. Give a firm decision with a brief reason. Number 3. Set examples and teach desirable values. Number 4. Funny and cool. And number 5. Strong in facing challenges with regards to the family and child rearing.
Did you respond yes to all these statements? That's right! Do you want to become a responsible parent? That's great! So what are you waiting for? Let's find out how.
First, let's define parenthood. Parenthood means being a parent. It should be composed of a mother and a father, which have a great responsibility or task that they are going to perform. Because parenthood is not just a role which can be successfully played on basis of chance, but it is a status where responsible couple arrive at after making a decision to have a family. The factors to consider when thinking of parenthood. First, happiness and stability of marriage. Second, physical and emotional readiness of both partners for parenthood. And the third one is financial stability.
So once these factors have been considered, the couple should also know on how to perform responsible parenthood. What do we mean by responsible parenthood? So how are we going to do it?
It should be shared responsibility of husband and wife. And also have the will and ability to respond to the needs and aspirations of the family and children. The couple should also mindful and have a decision with regards to the number spacing, number of their children according to their own family life aspirations.
So now, what are those responsibilities and duties of the parents to their children? Let me enumerate to you the duties and responsibilities of parents.
Let me enumerate to you the duties and responsibilities of parents. Provide physical care and love. Inculcate discipline. Develop social competence. Provide education. Train children to become a good citizens. Teach children to be financially responsible. And guide children to grow spiritually. To perform successfully these duties and responsibilities of parents, you should also consider the size of family that they are going to have. We have two kinds of family size: the small family and the big family. When we say small family, it is usually composed of the parents and at most 2 children. While big family, it is composed of parents and 3 or more children and other members. And now, let's take a look in the family structure. We have the nuclear families. Have parents and at least 1 child. Single parents, families have 1 parent and at least 1 child. Couples can be families without having children. And adopted families include 1 or more children who were born into other families. We have also the extended families, include members such as grandparents, aunts, uncles, and cousins. And the last one is the blended families, which are made when 2 families combine. Example, 2 single parents get married. family size has a possible effects on health. So we could possibly have nutritional status, morbidity, risk behaviors, and utilization of health services. When we say nutritional status, it's the state of body with respect to each nutrient and the overall state of body weight and condition. Morbidity exists from a state of physical and psychological well-being resulting from disease, illness, injury, or sickness. Risk behaviors, specific forms of behaviors which are proven to be associated with increased susceptibility to specific disease or ill. Health utilization of health services, experience of people as to the receipts of healthcare services of different type.
Congratulations, learners! We are now done for today's lesson with regards to responsible parenthood, roles and responsibility of parents, and successful family life. And I hope you learned something. And now, bear ready to our next activity. I want you to watch and analyze a very important and informative video from the Department of Education.
Isang taon pa lang ako, nasundan na ni Toto. Grade 2, 8 taon pa lang, 4 na bata ang inaalagaan. Grade 6, 12 na ako, kasing dami na ng pamilya ko. Sabi mo, pasensya na, walang pera kaya mag-drop out ka. Inakup, sabi mo kami mahal nyo. Ari ko pati kayo nagplano. Sana hindi gutom at nag-aaral pa. Alaga't malisog ang buong pamilya.
What can you say about the video? Yes, the video is all about a family having improper timing of childbirth, no spacing of childbirth, and as a result, parents cannot provide for their children's needs. And based on the video, what are the implications of not having a family planning to the community?
There is a vicious cycle of high child mortality and lack of family planning leading to high fertility rates and maternal death. High child mortality is not only a cause but also a consequence of lack of family planning. This vicious cycle can be broken by lowering child mortality and using family planning. Today, we will talk about the modern family planning methods, the natural and artificial. Are you ready to listen? Let's do it. Natural family planning or fertility awareness is a method of contraception where a woman monitors and records different fertility signals during her menstrual cycle to work out when she's likely to get pregnant. Now, let us talk about the three major classifications of natural family planning methods. First is the periodic abstinence or fertility awareness method. This rhythm method is an approach entails not having sexual intercourse on the days of a woman's menstrual cycle or when she could become pregnant. Second is the use of breastfeeding. It is a method of birth control that is also called the lactation elementary method or LAMP. It refers to the natural postpartum infertility that occurs when a woman is not menstruating due to breastfeeding. And last is the coitus interruption. It is also known as withdrawal or pull-out method. It is a very sensible rule to avoid insemination. Aside from three classifications of natural methods, there are also artificial methods of family planning. First is the oral contraception. This is a series of pills that women take each day for a month. second is the Depo-Provera. It is a method of birth control that gives in a form of shot. Third is the contraceptive patch. It looks like a shiny plaster and sticks to the skin. Highly effective to prevent you from getting pregnant by releasing hormones and stop the ovaries that keep the sperm from getting to the egg. Next is the intrauterine device or IUD. It is a tiny device that put into women's uterus to prevent pregnancy. Next is the contraceptive ring. It is a flexible plastic ring constantly releasing hormones that is placed in the vagina. Next is implanon or implant. It is a soft plastic stick about 4 centimeters long. The implant slowly releases hormone progestogen into your body. Progestogen is similar to hormone produced by the ovaries. Next is the diaphragm or cervical cap. It is a birth control device that prevents sperm from entering the uterus. The cervical cap is reusable. A deep silicone cup that is inserted into the vagina and fits tightly over the cervix. And last is the male condom. It is a thin rubber sheet worn on the man's penis during sexual intercourse as a contraceptive or as a protection against infection in sexually transmitted disease. Always remember that family planning or contraception reduces the need for abortion, especially unsafe abortion. It reinforces people's right to determine the number and spacing for their children. By preventing unintended pregnancy, family planning prevents deaths of mothers and children.
Here is our activity for today's lesson. Compose a 1-minute spoken poetry about the characteristics and importance of the different modern family planning. Record your performance through video and send it to your Mapeh teachers on Messenger. To test your understanding on our lesson, let's answer activity 2. Thumbs up, thumbs down. Sign thumbs up if you agree with the statement and sign thumbs down if not.
Number 1. Mom and Dad provides my basic needs. Number 2. Security is not the priority of my parents. Number 3. Father should be the breadwinner or provider of the needs of his family. Number 4. Husband should not be an active helper to his wife in rearing the children. And number 5. Both the father and mother inculcate values and discipline to their children. Did you get all the correct answer? Good job! Let's watch and learn through Fast Talk activity with Mom Hannah.
Number 1. Newborn screening is a simple procedure to find out if the baby has a congenital metabolic disorder. A must or must not? If your answer is a must, you are correct. Number 2. Breastfeeding is the traditional and ideal form of infant feeding, meeting an infant's nutritional needs for his first to 6 months of life. Is it essential or non-essential? If you choose essential, you are absolutely correct. Number 3. Responsible parenthood is the ability of parents to respect and do the needs and aspirations of the family and the children. Agree or disagree? If you agree on the number 3, you are perfectly correct. Number 4, family planning is the practice of controlling the number of children in a family and the intervals between their births. Prioritize, ignore. If you prioritize family planning, great job! For your quiz class, write your answer on your answer sheet. You have 5 points each.
Number 1. For you, what is the greatest challenge of Filipino parent? Justify your answer. Number 2. How does your family shares responsibilities at home? Explain your answer. For your assignment, continue working on creating your spoken poetry. When it is done, submit your final video to your respective Mapeh teacher or to your group chat.
Thank you, great learners. That's all for today. Remember, the best kind of parent you can be is to lead by example. Aim high, dream high, silang yans!